Have you ever used blood flow restriction in your rehab or your training? This is a common tool that we incorporate in a lot of athletes' rehab programs. But in the last couple of years, we've seen blood flow restriction take over and become key elements of training programs and replace traditional mass-based loading, which might not be the most efficient use of this technology. So if you haven't heard about what blood flow restriction is, essentially what we do is we take a typical blood flow cuff that's sized for either your arm or your leg, and then we have a machine that's going to take your blood pressure and essentially take a specific percentage of your blood pressure that will allow blood to flow into a limb but limit blood flowing out of that limb. And what this does is it allows us to see strength and hypertrophy gains in your muscle at lower intensity levels, meaning less weight than traditional mass-based loading. So to see similar strength or hypertrophy gains, we might be able to get that with 20% of a 1 rep max compared to 85 or 90% of a 1 rep max in traditional loading programs. So this sounds really great and really powerful, and it is in certain situations, like in rehab when an athlete is load compromised, which means that either because of a surgical precaution or because of pain, we're not able to challenge the athlete as much as we would like to or need to because of those limitations. We're able to use this blood flow restriction technology to still maintain or improve muscle mass and strength going forward. The other time that this can be very effective is during rehab. We can actually use it in maintaining conditioning. There's some interesting research that's been done where we're able to put the blood flow restriction on limbs and help improve VO2 max or the conditioning in maybe times that an athlete's not able to run, but they might be able to walk. We're able to get similar results out of that. So essentially, we're able to drive benefits from lower intensity training and get benefits like we were able to do more high intense training, which is very powerful. However, it doesn't replace mass-based loading. So what we're not getting with this is we're not getting the traditional overload of the bones and the tendons that we do with heavy strength training or heavier resistance training. And we still want to get those things because it's very important to strengthen the bones and the tendons as part of a traditional traditional strength training program. And so we don't want to go away from that. This should be an adjunct to that, not something that replaces it completely. Because we're stressing the body in a different way. Essentially, rather than mechanical overload like with traditional strength training, we're giving a metabolic stress to the body where we're trapping the muscle byproducts and we're tricking your body and your hormonal systems into thinking that it worked harder than it actually did. So this is a fascinating technology with quite a bit of research behind it, both initially in spinal cord patients or amputees in the military when they were trying to use different things to maintain muscle mass. That's where this kind of really got started in the US. And we've been able to take that and apply it to athletes in very specific ways. So this is definitely something that if you're an injured athlete, is likely at least a small component of your rehab program. We tend to use it earlier in rehab programs than later. And during the season, it might be an effective tool for certain aspects of your training program, but we should not only be doing blood flow restriction as part of your rehab or training program and completely replacing other training modalities. It should just be an adjunct to that. So if you haven't heard of blood flow restriction before, hopefully it's a little educational. And if you're using this right now in your training program or rehab program, now you might know a little bit more of why and how this should be implemented.